Friends and everyone, welcome to the church. Welcome to the church. Let's talk about issues that are concerning medical and health. We are going to talk about complications and danger signs. In ANC, antenatal clinic. Antenatal clinic. So if you are watching, you are here. Just a minute. You are here, you are a new person, this is your day here, the first day. Benjamin the Wise Guy is by name. Benjamin the Wise Guy is the channel. I'm Dr. Ben. So welcome my guys to the channel, welcome to the channel. Feel free to talk to the doctor here. Feel free to ask any question that you have, and we move forward. We move forward. Let me check this out. Seeing something here. I can see something here, Yes, that one. Yeah, we are in right now. So welcome everyone who is watching, who is here, who is watching, and everyone who is on. We want to talk about education. Say, Jamaican uncle is in, my friend, the first one today. Jamaican uncle, thanks for being here. If you are a new person and you're watching today, welcome to the channel. Benjamin the Wise Guy is the channel. I'm Dr. Ben. Welcome to the channel. Thanks a lot for being here, and every support is needed. So if you are a new guy and you are wondering, here we talk about medical issues, we discuss about mental health and good things that we to stay better in life when you are mentally stable and good health indeed. So if you are a new person in the platform, you have to know what to do. Subscribe to the channel. Don't just go. Increase the numbers by subscription and impressions by subscription, and tell us to the come to the chat and tell us where you are watching from. If you are watching around Africa, if you are watching in the US, if you are watching in the Asian countries, tell us your name. Let's get to interact, let's get to know each other. And I'm welcoming you. I'm welcoming you, even to give us more tips about mental health and more other. Greetings to you, Dr. Benjamin, and everyone. I'll be here in the background because I'm doing some massive work today. No worries, uncle. Thank you for being there. So if it is your first time to this channel, please do what? Subscribe to the channel. Come and subscribe to the channel. Come and hit the like button. And subscribe to this channel. Let's interact. Let's know where you are watching from. So today we are going to talk about something that is called danger signs and complications when it comes to antenatal visits. When a woman has conceived, is going through the journey of carrying a baby to bring this baby to the world, there are some signs that you should see, and then you say, no, this one is not, and complications. We want to learn about those complications so that we know how to keep Garja. Hi, bro. Garjai Sahanau. Hey. Hi, Darja, how is you? Give me a simple name that I can be calling you. Your name is, I can't even spell it unless you train me how to spell. Welcome so much to this channel. I'm doing fine, I'm doing fine. I want to talk about the danger sign. You know, yesterday we were introducing antenatal care. So welcome Gavja, thanks for being in the platform and always supportive and listening. So if you have any point, if you have any point that you want to give it to me, if you have anything that you want to support, if you want to support the talk of today, and if you have anything that you want to ask, don't fail to ask. Yeah, Gadia has done, done. Thanks for your like. If you are new in the channel, my friends, tell us where you're watching from. Don't fail to tell us. We are here to interactive session. So the topic of today is antenatal care complications and danger signs, but you can ask anything. So don't just watch, tell us where you are watching from. Tell us where you are and where you are watching this live show from. So in Kenya right now, it has been tensed, but we thank God where we are, that nothing major has happened. Everything is safe, everyone is safe. So today we are talking about the danger signs of antenatal care. Where do we start from? We start from danger signs or complications. Let's start from the complications of the danger signs of. Although we did some yesterday we went through some points. Today we will do some other points that are very important. We will do some other points that are important. Let's talk about danger signs in antenatal clinic. Danger signs in antenatal clinic. The danger signs in ANC. ANC is antenatal, the care that a woman undergoes to take care of the baby before delivery. That care, the drugs, treatment, nutritional care, that is called antenatal care. Now, there is one first danger sign that we have to talk about: vaginal bleeding. When you are pregnant, you don't have to bleed. When you are pregnant, you don't have to bleed. So bleeding can occur because of miscarriage. There are some things you should know which are very important when it comes to bleeding, vaginal bleeding. It's very important you got to know this. How can bleeding occur when you are pregnant? How can bleeding occur when you are? What can cause bleeding to occur when you are pregnant? One, bleeding can occur because of miscarriage. Bleeding can occur because of placenta previa. I'll talk about placenta previa, placenta abruption. Placenta previa is a placenta that has not been attached where it should be attached. You see, sometimes you can get a baby, then a placenta starts to grow at a specific place near the cervix, around there where it should not be growing. It can end up making you bleed. Placenta abruption, the detachment of the placenta from the muscles. Then you start bleeding. That one can make you bleed. Early labor, you start having early labor contractions. It should always be urgently, especially if it is heavy associated with pain. This one should be urgent. Danger signs, vaginal bleeding. You've seen there are several things that may lead to vaginal bleeding when you are carrying a baby, and it's very important you do what you take care of it by going to the hospital. Let me leave this here. If you have any questions, my friends, anyone who has a question here, don't fail to ask the question. Just ask the question, and then we continue with Burnout to be Blessed is here. Burnout to be Blessed. Nowadays, you have two channels: Burnout to be Blessed and the other one, which was called what? I'm trying to arrange this place because I have several things here. Let me arrange this place like this. Yes, that one is okay. Now, welcome, Burnout to be Blessed. We are talking about danger signs and complications when it comes to antenatal care. Antenatal care. Now, you have seen bleeding can occur because of several things. Bleeding can occur because of several things. The placenta attaching itself where it's not supposed to be attached. It is called placenta previa. Placenta abruptio, the detachment. The placenta should be attached. Pronounced burn out to be blessed. Also known as Queen CNLB. Queen CNLB. Alright, yes, let's continue. Placenta abruptio, the detachment of placenta from where it should be. The detachment of placenta from the muscles, and then you start bleeding, or early labor. Yeah, that is a danger sign. Bleeding in labor is a danger sign. Very important. You should go to the hospital to be managed. Severe lower abdominal pain. Severe lower abdominal pain. This may suggest miscarriage. Lower abdominal pain when you are pregnant, mostly at the first trimester, 12 weeks or 3 months. This may suggest miscarriage. Ectopic pregnancy. Ectopic pregnancy, we said it is pregnancy that is attached on the fallopian tubes. So when it grows up, you may get a rupture and then you start bleeding. Placenta abruptio. When the placenta is detaching itself from the muscle, very many things can cause that. You feel pain because it's a wound inside. Pain comes. Urinary infections. Infections are very common when ladies are pregnant because the cervix is kind of like open and wide. So it makes more infections to go. Or preterm labor. Preterm. Preterm means before term. Before the baby's time is there, you start having labor. You see, that is called preterm labor. You start feeling pain. Persistent worsening pain needs urgent review. When you have persistent lower abdominal pain, you just know that it can be placenta problem, like placenta abruptio, urinary infection, preterm labor, persistent or worsening pain, needs urgent review. Now, severe headache. When you are pregnant, you start feeling you have a headache that is pounding. It's always coming and hitting you. A severe headache in pregnancy may be warning sign of high blood pressure or preeclampsia, particularly after 20 weeks. High blood pressure. There are some people who have high blood pressure normally, and they are on drugs to manage the pressure. But you see, when you are getting you are on antenatal care, someone may have high blood pressure because of compensation. You are carrying a baby, and that baby, most compensation starts you to have high blood pressure. Those are the things that we look at, and then we say this is a problem that we need to check on when a mother is going to ANC. You see, yes, headache. Yes, headache is, yes. Okay, so headache is a sign that several things are happening. We've talked about headaches. Yeah? Headaches is a very important sign, significant sign when a person is having pregnancy. So don't ignore pregnancy, because a mother may end up getting to eclampsia. You convulse and then you injure the baby plus yourself. You injure your baby plus yourself. So when someone is pregnant, and this person who is pregnant is having several headaches, you should be checked on. Even if it is mild headache, go and check your doctor. Vision. Sometimes, if you are coming in and you have a question, please don't fail to ask the question. You see, What's happening here? Something is telling me. Let me check this out, okay? If you have a question, just ask the question, because sometimes understanding is very important. Those signs like blurred vision when a person is having yes, those signs that we are talking, they are very important. Just a minute. Burnout affects pregnancy, causing one increased stress levels leading to preterm birth. Yes, that is an important point. There's something I'm answering someone here. This I'm answering is burnout to be blessed. Said burnout affects said increased stress levels leading to preterm labor. Yes, when you have increased stress levels, what can happen? What can happen is you will have high blood pressure, and high blood pressure will lead you to have eclampsia, and eclampsia will lead you to have problems. Just a minute, I come, I see a child here, I come. Yes, I'm back. Burnout has said that stress levels can cause you to have preterm. Yeah, that is very okay, correct. It's very correct. If you have stress levels, it can lead you to have preterm birth. That is very correct. Blood vision or seeing spots. Changes in vision when you're pregnant. When you're pregnant and you are seeing changes in vision, mostly when the pregnancy is progressive. Flashing lights or double vision. It may be a sign of high blood pressure. It may be a sign of your pressures are high and it's causing you to have double vision. You know, when pressures go high, your eyes have something that is called cupping. So it becomes less, it becomes bigger. So you start having blood vision. Why is it dangerous? It is a sign of elevated blood pressure affecting brain and eyes, because you remember the 12th cranial nerve, the second one is called what? Optic. So it may be injuring the optic nerve. That's why you are seeing double vision. Signs. These are called the signs and symptoms of bad signs when it comes to ANC, antenatal care. When it comes to antenatal care, swelling of the face and hands. You know, when your face is swelling, it explains something. Your kidneys are suffering and you are having water retention. So it may be a very bad sign. Sudden swelling of face, especially hands and legs. Preeclampsia. It's called preeclampsia. And why is it dangerous? It may indicate worsening high blood pressure risk and seizures. You may have high blood pressure and then you start having seizures, which is a very bad sign when you have a baby. You are carrying a baby and you want to get a healthy baby. So, my friends, these are bad signs. Swelling of the face, blood vision, and you know, most of them that I'm talking about, you have understood that they are doing what? They are heading to high blood pressure. But the difference here that I've talked about, one, that is vaginal bleeding. Vaginal bleeding is different, but because that one it says miscarriage, placenta previa, it's physical trauma. Most of bleeding comes from physical trauma, like detachment of the placenta. You see things like those ones, detachment of the placenta, detachment of all those. You see, those are things that we talk about. High fever, body temperature above 38 degrees centigrade, 38. In Fahrenheit, that one is around 100 and what? Let me check. Fahrenheit. So high temperatures, when you have high temperatures, just know you are never going. One, you check infection. Oh, that one is 100. 38 degrees is 100.4. 100.4. See, Fahrenheit. So if you go to a clinic, you check yourself, they see that you have high temperature, the first thing they have to do is something called fullemogram, and then they take urine to check if you have any infection that is going on. If there is an infection, you are given on appropriate antibiotic, not all antibiotics, because there are some antibiotics that you should not use when you are pregnant. There are some antibiotics that you should not use when you are pregnant, you see. So, my friends, as we talk, check on this. If someone is pregnant with high fever, this person may be undergoing malaria, urinary tract infection. That's why you take urine and check, because urinary tract infection might encapsulate to the body and then you start having systemic infection. other bacterial or viral infections, even the flus that people have, you may have them. So it is important to do what? Checking these things as we progress slowly by slowly. Leila is here from Gong. Welcome. Welcome to the topic. We are talking about danger signs when it comes to antenatal care. Danger signs when it comes to antenatal care. Fever can harm the mother and the developing baby because high fevers in a person may cause what? Convulsions. And convulsions may cause injury to the brain of the baby and even you the mother. You see, things we should check on when we are talking about some things. Yeah? You see? United of Ngong, as always. Welcome from United of Ngong. Convulsions. A mother is having in the first trimester, second trimester, and then you suddenly start having convulsions. Imagine convulsions. Sudden uncontrolled movement with loss of consciousness. That is called convulsions. It's called convulsion, and convulsions are not good. They may injure the brain of the baby, and you, the mother, even you. It may injure you. It may injure you. So, you need to go to the hospital because with convulsions, when you are pregnant, only a qualified medic needs to handle you because you can be given some drug with the people over the counter out there and they injure the baby. You see? So let's talk about these convulsions like eclampsia, high blood pressure that has gone with, when you have high blood pressure and your kidney is suffering, you have something called proteinuria. Protein in urine, that is when we say you have eclampsia. Eclampsia, and when you have eclampsia, you see the kidney suffering and convulsions and fits may come in. So when convulsions and fits may come in, you start having problems with the baby in the stomach and you yourself. You have had something that is called intrauterine fetal distress. The fetus is not getting enough oxygen and nutrients. See, because of high blood pressure. Why is it dangerous? Why? It may end up to retardation. Let me not call that word that I don't like calling. Very important. Now, a mother, you are just okay and suddenly you start having difficulty in breathing. You start having difficulty in breathing. You start having problems with breathing and shortness of breath or irritability, inability to breathe normally, or you will be irritable yourself because you are not getting enough air. You are not getting enough air. This one can be a sign of anemia, can be a sign of heart disease, can be a sign of lung infection, pneumonia, bronchitis. You see, all those lung infections that we talk about. So severe anemia, heart diseases, when you start having difficulty in breathing, difficulty in settling, you are settled anyway. The only place you should go is the hospital. Why am I saying the only place you should go is the hospital? Because the choice of drug and the diagnosis when you are pregnant, it should be done with a doctor who is qualified. The choice of drugs and your management. You are having a life inside you. Having a life inside you means proper care and handling. You get that, my friends? And that's why we tell all the mothers that are expecting baby, it is very important you start going to antenatal clinics to get this knowledge. Several women get pregnant and then they don't know where to start from. but now you can start from somewhere when you are empowered with information. You see, when you are empowered with information, you can start from somewhere. Reduced or absent fetal movements. Reduced or... Who is calling me?
This is DJ Da Silva, the music lecturer. Stone. It's DJ Stone. The world is a stage, and I'm playing my part. Everything I do.
Someone called and so we continue with our hello doctor. Yes, let's continue with the talk. Yes, let's continue with the talk here. Yes,
Mama ameleta vijana mmoja bila kumsema.
si alisema atamleta kesho. Sasa wanangoja sasa ile nini ndio wanamleta kwako. Okay, let's continue with the talk. Okay, Soa is here. Sorry, there was a confusion and there was a call and then the network went down. So let's talk about convulsions. Convulsions is a very important sign when someone is having a pregnancy. It may be a sign of eclampsia, and I've said eclampsia is high blood pressure. Eclampsia is high blood pressure that ends up to injure the kidney, and the kidney may start producing proteins because of the pressure from the heart. So when you get something that is called proteinuria, that is where we have the problems with eclampsia, and it may end up having a convulsion. You see. Now there is an important factor about eclampsia and preeclampsia. When women are pregnant, high blood pressure can be rated into two. Eclampsia, let me read this. What's happening here? There is two things that happen. There is eclampsia and preeclampsia, and we will know about these two, eclampsia and preeclampsia. Those are two special things that you should know. They are hypertensive disorders of pregnancy that usually occur at 20 weeks of gestation. When you have 20 weeks of gestation, you start having eclampsia. You start having high blood pressure. You see, you start having high blood pressure. Check that. So you are there, and yes, my friends, I think just a minute, I come back. Jelon Lebron has come in. Welcome. Now, I was talking about several things that are very important, and these are eclampsia and preeclampsia. Those are two important things. Dorothy, after year 1.5, yes, we are talking about eclampsia and preeclampsia. Jello, welcome to the chat. After hizo tukumbuka tutamwekea B12 na dexamethasone ndio hiyo mkohozi.
Okay.
Yes.
Hii nianze na ya kwanza.
Lebron, Jello vote. So what? Jello, which side are you coming from? Which state are you coming from? And let's see. Which state are you from? Welcome to the chat, and let's talk about. We are talking about preeclampsia. Preeclampsia. Sorry, I'm becoming busy here and there, and I'm really here and there. So if I go, I come. Just bear with me. I'm at work. So let's talk about the preeclampsia and eclampsia. Preeclampsia. What is preeclampsia? All of these two are complications of high blood pressure when you are pregnant. These two are complications of high blood pressure when you are pregnant. And when you have the complications of high blood pressure, they are divided into two: preeclampsia and eclampsia. So preeclampsia and eclampsia are hypertensive disorders of pregnancy that usually occur after 20 weeks of gestation. Now, we can say that new onset hypertension after 20 weeks with proteinuria and or evidence of organ dysfunction. That one we call preeclampsia. What is proteinuria? Proteinuria is where you find urine with some proteins. When you do urinalysis, the dipstick, you find that urine with some proteins. You see, that is called proteinuria. And then eclampsia. What is eclampsia? Let's talk about eclampsia. Eclampsia is when now you're getting BPs are so high, the pressures are so high, and then now you have the seizures, not due to any other cause but the high blood pressure. When you have the seizures, this is where we call, now you have the eclampsia itself. But you can have high blood pressure with only proteins in urine, so showing that there is kidney dysfunction or the kidney is suffering because of high blood pressure. So you can have proteinuria or evidence of organ dysfunction. Any organ, it can be the pancreas, it can be any organ with some dysfunction. You see, those ones are the main things, the definitions of preeclampsia and eclampsia. Those are the definitions. So one has proteinuria or evidence of organ dysfunction, and the other one has preeclampsia, complicated generalized tonic-clonic seizures due to another complication. You see, let's continue. I think someone has understood the hypertensive problems when it comes to antenatal care. They are divided into two: preeclampsia and eclampsia. But preeclampsia is organ dysfunction or protein in urine, but eclampsia is something that shows you have high blood pressure until you start having convulsions. Just imagine. Now, any blood pressure that is above diastolic 140 and 90, in 4 hours, two occasions, like on Monday or Wednesday, in 4 hours, what do we say? We say that that is high blood pressure, but it's preeclampsia. Because now you don't have the seizures. We are talking about complications, high blood pressure complications when it comes to antenatal care. Antenatal care, preeclampsia and eclampsia. So we have said preeclampsia is when you have high blood pressure more than 140, diastolic and systolic of more than 90, and in two occasions that are apart. Like Monday and Tuesday, you do your test, on Wednesday and Thursday, you find they are still high. They are still high. But here we have eclampsia. Eclampsia comes with high blood pressure with seizures. Fit, because it's very high. Let's talk about the proteinuria. Why is it that you can have proteins in urine? It's because you are having high blood pressure, the heart is beating so hard until the pressure in your kidneys are so high and they are forcing proteins to come in urine. That is called proteinuria. Protein should not be in urine because they will not have something that is called good pressure in the blood vessels. It's called oncotic pressure. Oncotic pressure. 300 milligrams per 24 hours, or protein and creatinine ratio of 0.3, or urine dipstick of protein more than 1. There is a way we check the protein and creatinine ratio, the proteins in your urine. We balance them and then we know. Like if you have 300 milligrams per 24 hours of protein, we know that this is protein. Or protein creatinine ratio of 0.3, or dipstick. You take the dipstick, you put in urine, and then you see +1 or more. That is, protein in urine. That is preeclampsia. But in eclampsia, usually present but not essential. You can have it, but the marking point of eclampsia is seizures. You start convulsing. You start having the convulsions. You get? So in preeclampsia we have seizures. In eclampsia in preeclampsia we don't have seizures, but in eclampsia we have seizures. See that? Very important topics, my friend. Very important topics here, my friends. We have preeclampsia and eclampsia. These are complications of high blood pressure in pregnancy. When you are having a pregnancy and the baby is growing, you tend to have more of demands, and very many things happen. So more of demands and many things happen yield you to have some complications like high blood pressure. And I've said there is two types of high blood pressure when you are having ANC. Two types of high blood pressure, preeclampsia and eclampsia, are hypertensive disorders of pregnancy that usually occur after 20 weeks of gestation. Usually, if you check on the women 4 months, when you have 20 weeks, how many months are those? Those are like how many months of gestations? You see? So there is a very important topic that we should check on, of eclampsia and preeclampsia. New onset hypertension after 20 weeks with proteinuria or evidence of organ dysfunction. You see, you start having organs dysfunction. When I say you are preeclamptic, how can I really put this point through? Hope someone is listening and following. When you are pregnant at around 20 weeks of gestations, 20 weeks, 5 months, around 5 months, you start having high blood pressure. And when you start having high blood pressure in pregnancy, we divide them into two. When we divide them into two, how do we call them? We call them pre-eclampsia and eclampsia. You see, pre-eclampsia and eclampsia. Thanks, Soya. Thanks so much. Please share and tell people we discuss important things here. So, pre-eclampsia and eclampsia. High blood pressure in pregnancy is divided into two: pre-eclampsia and eclampsia. When you get to 20 weeks, and then we see you have continuous high blood pressure, but we took your urine, your blood pressure, that is diastolic 140/90 systolic, we take your urine and then we check, we see you have proteins in urine. It means your blood pressures are so high and the heart is beating so hard, and it is forcing proteins in the kidney to be filtered out. So that scenario is called proteinuria. Protein in urine. Proteinuria. Protein urine. 300 micrograms per. We check the protein in urine, we see you have more than 300 micrograms of protein. Or when we do a kidney function, we check creatinine and proteins, and then we take the ratio, we saw it's 0.3, or we take the urinalysis stick, we dip, we see you have +1. We say that you have something that is called pre-eclampsia. Seizures are absent. Here you don't convulse, you don't feel, but with the same things that I've said, and then you add something that is called seizures. Now you are eclamptic. It is called eclampsia. You are in the sense of convulsions, eclampsia, but at times you may not have proteins in urine as you convulse, or you may have proteins in urine again. So it depends. So that is the difference, and the difference. Oh, Coffee Cakes is here. Coffee Cakes, welcome so much. Today we are talking about important danger signs in ANC, and this thing that is called proteinuria. It's very important because it shows organ damage. Coffee Cakes, how are you doing? Hope you are doing fine. Welcome to the channel. Welcome to the chat, my friends. Wherever you are, may God bless you. Thank you so much for hitting here and saying, let me check on my friends. My friend is online. Thank you so much for being here. So yeah, which part of the world are you from? Are you from the US? Are you from Asia or Africa? Please tell me. So yeah, where you are from. Now, that is what we call proteinuria. It tells us there is an organ that is suffering. And what is this organ that is suffering? Most of the time, the organ that is suffering is, when you get to proteinuria, is the kidney. We will talk about high blood pressure in pregnancy as a topic. And the causes of high blood pressure, I've said high blood pressure in pregnancy, divide it into two: eclampsia and pre-eclampsia. Pre is before getting the convulsions. That's how you can know. And eclampsia is the convulsions. From Jamaica, living in Georgia, US. Oh, Soya, okay. Thank you. I see I have many friends from Jamaica. Wow. Now, let me give a review before we continue with the topic. Causes of this: vasospasms, reduced organ perfusion. First pregnancy is a risk factor. Previous history, if you've had preeclampsia, multiple Jamaican uncle, very nice. Diabetes mellitus, chronic kidney diseases. We will talk about eclampsia and preeclampsia. So stay tuned. They cause convulsions, and it is a danger sign when you are pregnant. And remember, that topic has come because of convulsions in pregnancy. Let's talk about difficulty in breathing, shortness of breath or irritability, to breathe, irritability and inability to breathe normally. What may it show you? Anemia. When you lack, you have low hemoglobin, you have low capacity of carrying, oxygen to the brain and the organs that they are needed to. See that? So that is called hypoxia. Lack of oxygen, hypoxia. But even we have several types of hypoxia. Here we have said difficulty in breathing may be caused by anemia or heart disease. We have types: hypoxia, microcytic hypoxia, hypoxic hypoxia, different types of hypoxia. There is one that is called hypoxic hypoxia, low arterial oxygen. In the bloodstream there is no oxygen. There is anemic hypoxia. You have anemia, you don't have enough oxygen, red blood cells to carry the oxygen. Histotic hypoxia. Cells cannot utilize oxygen well. Despite adequate oxygen delivery, your cells cannot. You see? So we have histotic hypoxia, anemic hypoxia, stagnant hypoxia, and hypoxic hypoxia. You see, those are types of hypoxia. We will learn about them. But right now we are talking about complications and issues incurred when you are having a baby. You are expecting a baby, mostly at 20 weeks of gestation. Lung diseases, heart diseases, and this one, when you are pregnant and you cannot have oxygen. When you don't have oxygen, you may have a problem. You may have, even the fetus may not grow well, and also there are some things that may happen that may go bad. Intrauterine fetal retardation, because it's not receiving oxygen and nutrients as is required, and it requires more iron, nutrients, so that the fetus can grow well and continue growing well. You see, very important. Let's talk about something that is called what? Reduced or fetal movement. Reduced fetal movement. Reduced fetal movement is a very important factor when it comes to you as a lady carrying a baby. The baby moves less than usual or stops moving after 28 days. It may mean that this baby is not getting enough nutrients or oxygen. Or the other one, which is dangerous, the fetus has died. So anytime you feel this baby today has not moved, it is a good thing for you to go to the doctor. Do an ultrasound, let the doctor check the condition of the fetus. At around 6, you see, these are very important things that you should be following. Let's talk about leaking of fluids from the vagina. Fluids, blood is fluid. There are several types of fluid. Even the amniotic fluid itself is fluid. The amniotic fluid is the fluid that holds the baby. So you will find that continuous leaking of clear fluids before labor. What may happen? Continuous. Premature rupture of membrane, 1. Placenta abruptio, 2. placenta previa 3, because blood is a fluid. So placenta abruptio, you'll see fluid coming from, and I've said placenta abruptio is when the placenta has detached itself from the uterus lining, causing bleeding. Placenta previa is when the placenta itself has attached itself to where it is not supposed to be attached. You get? So these are the things that we should be checking and looking at them. Persistent vomiting. Why is a person having persistent vomiting when this person is pregnant? Why is the cause? Why is it a very significant sign and you need to see a doctor? Why? Frequent vomiting that prevents eating or drinking. It is called hyperemesis gravidarum. You've heard of this. Morning sickness. Yes, morning sickness. Morning sickness is always there, but morning sickness mostly is brought by hormonal imbalance and disturbance. All the time sickness. Yes. Most of the time it can cause dehydration, weight loss, and electrolyte imbalance. You know, when you vomit a lot, you don't get in some electrolytes. So when you find out that you are having the morning sickness and you are pregnant, you should talk to your doctor, especially when vomiting is coming in. You know, you can have nausea with the morning sickness problem, but you may not have the vomiting. But when vomiting comes in, that's why we tell pregnant women, when you are coming out of bed, you should not come out of bed abruptly and start doing things. Come gradually, sit. Let your body have the transition well from sleeping to now. As you wake up well, so that the transition cannot lead you to have the vomiting. Ginger helps, but the doctors have a way to prescribe some medication so that if you feel it is going on too much, you take the drugs to reduce the morning sickness. You see, to reduce the morning sickness. There are some things like we will talk about hyperemesis gravidarum when due time comes. It's a very important topic. It's a very important topic, hyperemesis gravidarum. Painful urination means infection. Burning or pain while passing urine. It means you have urinary tract infection. You have urinary tract infection. And urinary tract infection, yes, urinary tract infection is different from sexually transmitted infection. When women go to the first time of the ANC clinic, the first thing they have done is urine test. Johnny Be Good is here. Bro, how is everything? Good day, bro, Dr. Benjamin and chat. Yes, thank you, Johnny Be Good. Yes? Dr. Mwana kwa corridor. Wapi? Ni sawa. Hapa kwa kiti ni sawa. You see, you have this burning sensation. Johnny Be Good, bless her. Thanks for tuning in. Always hit the like button, share this, tell people we talk about good things here and we talk with respect and dignity. You know, many people avoid the online because they don't want to expose themselves, but here is a good place. So when you have these things that I'm saying, there is a difference between UTI, urinary tract infection, and sexually transmitted disease. Sexually transmitted diseases are like gonorrhea, syphilis, herpes, and then we have UTI because of infection, which you can get from the clothes that you wear, your sanitation. You see, and when it goes up to the bladder, it is called cystitis. When it gets to the kidney, you get nephrotic syndrome, nephritic syndrome or liponephritis. Those are the things that we should learn. It starts, I share it with a friend, that's good though a lot, but I'm not sure he's available to come. Oh, no problem, at any time that they want, they can come. A minute, my friends, I see someone, I'll be back. What is your take on eclampsia and preeclampsia? How do you think those two things are? Yes, my friends, I'm back. Now, let's talk about, we are talking about painful urination and such. Now, there is a difference between those two things. We'll talk about STDs and UTIs. The strains that the bacteria and protozoas that you can get at sexually transmitted diseases and urinary tract infections. Those are two major things when it comes, and that's why when women go for antenatal clinics, the first thing they are screened on is, if you check on that book, I don't know if I got one here, let me see if I have one in my desk. Unfortunately, I don't have one. If you check on those books, you will find that there is one that has STIs place, UTI place, blood grouping, hemoglobin levels. They are very important factors, because if you have a child and you have chronic infection and you have infection, mostly STDs, it may affect the baby and you may bring out the baby that is having neural tube development problems with the brain, because the brain is injured. The brain is injured because of those mostly sexually transmitted infection. You see, painful micturition, we call it painful micturition. Micturition is painful urination, burning sensation and pain. You see, It's very important, very, very important. Now, common complications that are in pregnancy. There are some common complications that you get in pregnancy that let me just go by. But tomorrow we'll talk about preeclampsia in details. High blood pressure in pregnancy in details. That one we have to talk about it in major, in a wide spec tomorrow. Now, there are some complications that you can get when you are pregnant, and they are so important. These complications are like preeclampsia. We have done the overview of preeclampsia. Severe headache, blurred vision, swollen face and hands, high blood pressure. Complications are seizures, stroke, kidney failure, and poor fetal growth. You see. Now, diabetes is another complication. High blood sugar first diagnosed during pregnancy may be a problem. High blood sugar during pregnancy may be a problem. This one is a very bad situation. Increased frequent urination, often, sometimes dizziness, blurred vision, and then when you go and do a prick test, random blood sugar, you find that your sugars are very high. Blood sugars. We'll talk about these things in due time, like gestational diabetes. This is diabetes that is diagnosed when you're having diabetes that is diagnosed when you're having a baby that you are expecting. Anemia. These are complications that I'm talking about. Complications during pregnancy, preeclampsia, gestational diabetes, anemia. We'll talk about anemia in pregnancy. Placenta previa. I've talked about placenta previa. Placenta previa is when you have a placenta that has detached from the muscles. A placenta that is attached where it should not be attached, at closely to the os or near the os where the cervix is, so it gets on bleeding. Placenta abruption. Placenta abruption is when the placenta is detached from the muscle, the uterus, so you start bleeding. Preterm labor. Labor starts before the baby is fully mature. Labor starts before the baby is fully mature. See, this is a complication. We have premature rupture of membrane. Premature rupture of membrane, because you are having a premature complication, rupture of membrane. It may cause you to have a problem, which may in turn stay for so long, and it may injure. The baby may be born with problematic issues like low birth weight. Then your baby put on somewhere where it can grow until the time of maturity comes. Incubators. You see, yes? For now. Anataka kunywa nini?
Alikuwa anasema soda, nami nilikuwa namuuliza kama naweza tumia kama 20 minutes.
Mpe soda tu.
Gani?
Yote yenye anataka. Yes, let's continue. Sorry for interruptions. Today has been a day of interruptions. Labor before the baby is fully mature is called preterm labor. Premature rupture of membrane. Amniotic fluid comes out. The baby is not term, maybe it's 30 weeks. And that is a complication. These are things that we will talk about slowly by slowly. We'll talk about them slowly by slowly so that we understand. So for tomorrow, we are starting to talk about something that is called high blood pressure in pregnancy. There is something that is called hyperemesis gravidarum. Hyperemesis gravidarum is severe vomiting causing dehydration and weight loss during pregnancy. We'll talk about it in due time. Urinary tract infection is a complication. In pregnancy, is a complication. My green tea is here, my friends. Green tea, as always. That one. Very important. Very, very important. Urinary tract infection. Fever, lower abdominal pain, kidney infection, preterm labor, low birth weight, miscarriage. Let's talk about miscarriage when time comes. These are complications when it comes to antenatal care. Some people even get stillbirth. Stillbirth is a baby that has died. That is a complication. No fetal movement, no heartbeat. Those are the things that we will talk about them in due time. So you plan yourself that tomorrow is a good day. Tomorrow is a nice day. Tomorrow is a very nice day. Today in Kenya we were having a tense moment. People have not gone to work. Children were, some schools did not go to school. Some schools people did not go to school because there was a time called Sabasaba, commemoration of. It was where the people are protesting of democracy. And today people were saying they go to the streets to remember that day because things are not going good in the government. So anyone with any question before I leave? I have 6 minutes to go. Anyone with any question here? Anyone with any question, my friends? Before I leave, anyone with any question? Yes, I'm waiting for any question before I leave. My friends, it has been 1.5 hour session. 1.5 hour session. 1.5 hour session. Yes, we have talked about complications and danger sites in antenatal care, which are very important. So let's talk tomorrow about the other things that are coming. We'll talk about high blood pressure in antenatal care and pregnancy tomorrow. That is what we'll talk about. So stay tuned, my friends, and everyone who has been watching. Thanks a lot, and be blessed for everyone that has been here. Although I've been in and out and about because of work, I'm at work right now. So no worries, tomorrow we meet again or at 10. So bye, see you guys.